Hello, I'm Laurette Salzman, Senior Risk Resource Advisor with ProAssurance. Patients call physician offices after hours for numerous reasons. Some of the most common reasons involve medication concerns and refills, pain, fever, nausea, obstetric questions, and pediatric-related issues. Consider the following strategies to manage risks associated with after-hours calls. First, provide patients with information on how your office handles after-hours calls and provide instructions on how to access an on-call physician after normal business hours. Next, consider implementing written physician-approved telephone guidelines for calls triaged by non-physicians and ensure only appropriately trained professionals operating within their respective scope of practice are utilized. At a minimum, the guidelines should include frequent, urgent, and emergent complaints and responses, conditions requiring immediate physician consultation, criteria to ensure appropriate follow-up, and how to handle requests for controlled substances. Furthermore, when a physician practice does not have access to complete medical histories for patients, consider limiting treatment advice to scheduling an appointment or refer to an emergency department. Review and update your guidelines on a regular basis and monitor to ensure your after-hours processes are functioning as intended. Concerning documentation, record all medically relevant telephone conversations and include, at a minimum, the date and time of the call, the patient's complaint and symptoms, any medical advice given including final disposition, relevant prescription information, the identification of the person who received the call, and any evidence of physician direction or supervision as appropriate. Additionally, if you use an answering service, obtain a list of calls from this service in order to promptly document in the medical record, to communicate to other healthcare professionals, and to ensure appropriate follow-up takes place. In the end, effective management of patient calls may help improve patient satisfaction and safety and decrease your medical professional liability risk.